9 daily habits that slowly damage your heart. Most people believe a heart attack begins the moment it happens. It doesn't. In the vast majority of cases, it begins years earlier, quietly, inside habits so ordinary that nobody thinks to question them. This video is for educational purposes only and is not a substitute for professional medical advice. If you have concerns about your heart health, please speak with a qualified healthcare provider. Here's what makes this topic so unsettling. The heart doesn't usually send loud warnings. It sends small ones, and most of us learn to ignore them because life is busy and nothing feels urgent until it suddenly is. A tightness in the chest gets blamed on stress. A little fatigue gets blamed on a bad night's sleep. And because the heart keeps beating through all of it, quietly, reliably in the background of every single day, it's easy to assume that reliability means it's fine. It doesn't always mean that. Over the next few minutes, we're going to walk through 9 habits that researchers and cardiologists have repeatedly linked to long-term heart strain. Some of them will feel familiar right away, the kind of thing a doctor might have mentioned to you once in passing. Others will genuinely surprise you because they don't involve food or exercise at all. They involve things like emotions, relationships, even how often you visit the dentist. And stay with us until the end, because one habit on this list is often the hardest for people to recognize in themselves, even though it may be quietly doing more damage than the other 8 combined. Number 1, sitting for long stretches without moving. There's a phrase that's been circulating in cardiology circles for the past decade: sitting is the new smoking. It sounds dramatic, and honestly it oversimplifies things a little, but the underlying research is real. When you sit for extended periods, your muscles stop actively helping to circulate blood the way they do when you're upright and moving. Blood flow slows down, and over time this has been associated with higher blood pressure, unfavorable changes in cholesterol, and increased strain on the cardiovascular system. What makes this particularly sneaky is that it doesn't feel like a health decision. Nobody sits at their desk for 8 hours thinking, "This might be hard on my heart." It just feels like work or rest or a long drive. Researchers have found that the risk associated with prolonged sitting appears even in people who exercise regularly, which was a genuinely surprising finding when it first came out. In other words, an hour at the gym in the morning doesn't necessarily cancel out 10 hours of sitting afterward. Consider someone like Robert, a 58-year-old accountant. Robert prided himself on being disciplined. He walked 3 miles most mornings before work, but tax season meant 12-hour days at his desk, barely standing except for coffee and bathroom breaks. When his doctor flagged elevated blood pressure during a routine checkup, Robert was confused. He was doing everything right, or so he thought. His doctor gently explained that movement throughout the day matters just as much as a single dedicated workout. It's not about replacing exercise. It's about breaking up the long, motionless stretches that may be quietly working against it. The good news is that this particular habit is one of the easier ones to adjust. Standing up every 30 to 60 minutes, even for a short walk to refill a water glass, has been associated with measurable improvements in circulation and blood sugar regulation. It doesn't require a gym membership or a lifestyle overhaul. It just requires remembering that the body was built to move, not to stay still for hours at a time. Some workplaces have started encouraging walking meetings or standing desks. Small structural changes that quietly reduce the total hours of stillness in a day without asking anyone to find extra time they don't have. Robert, for what it's worth, started setting a simple timer during tax season. Not a dramatic fix, but 3 years later, his blood pressure readings had returned to a healthier range, and his doctor credited the change as much to those small, repeated interruptions in his sitting as to anything else. But sitting is only part of the picture. What happens after the sun goes down may matter just as much. Number 2, consistently getting too little sleep. Sleep often gets treated as optional, something to sacrifice when the to-do list gets long. But the heart doesn't see it that way. During deep sleep, blood pressure naturally dips, giving the cardiovascular system a kind of nightly rest period. When sleep is cut short or repeatedly disrupted, that dip may not happen properly. And over months or years, this has been linked in research to higher rates of hypertension, irregular heart rhythms, and increased inflammation throughout the body. There's also a hormonal piece to this that surprises a lot of people. Poor sleep has been associated with elevated cortisol, the body's primary stress hormone, along with disruptions to hunger-regulating hormones that can make late-night snacking and poor food choices more likely. So the damage isn't limited to the hours you're actually asleep. It can ripple into the following day in ways that compound the problem. Take Diane, a 61-year-old grandmother who had convinced herself she functioned fine on 5 hours of sleep. She'd done it for 30 years, she said, so clearly her body had adapted. What she didn't realize was that consistently short sleep doesn't necessarily mean the body has adapted in a healthy way. It may simply mean the warning signs have become background noise. When Diane finally underwent a sleep study after months of feeling unusually fatigued, she learned she had mild sleep apnea, a condition where breathing briefly stops and restarts throughout the night, placing repeated stress on the heart without the person ever fully waking up to notice it. This is part of why cardiologists increasingly ask about sleep quality, not just diet and exercise, when assessing heart health. It may be helpful to think of sleep not as downtime, but as an active repair process, one the heart depends on just as much as the brain does. Number 3, letting chronic stress go unmanaged. A little stress isn't the enemy. Short bursts of it can even be useful, sharpening focus during a deadline or a difficult conversation. The concern lies with stress that never really turns off, the kind that hums quietly in the background of someone's life for months or years. When stress becomes chronic, the body maintains elevated levels of hormones like cortisol and adrenaline for far longer than they were ever designed to circulate. And this has been associated with increased blood pressure, inflammation, and unhealthy coping behaviors like overeating or drinking. What's often overlooked is that chronic stress doesn't always look dramatic from the outside. It's not always the person visibly panicking. Sometimes it's the quiet, high-functioning person who's simply been running on tension for so long that it feels normal to them. James, a 54-year-old small business owner, is a good example. He wasn't the type to complain. He described himself as someone who just handles things. But after years of financial pressure and long hours, he began experiencing chest tightness that sent him to the emergency room. Tests showed his heart itself was structurally fine, but his blood pressure readings told a different story, one that had likely been building for years. His doctor explained that unmanaged stress can act almost like a slow, steady tax on the cardiovascular system, one that doesn't show up as a single dramatic event, but as a gradual erosion of resilience. This doesn't mean stress needs to be eliminated entirely, which isn't realistic for most people. It may simply be worth paying attention to how stress is processed, whether there are outlets like exercise, conversation, or rest, or whether it's simply being absorbed silently day after day. Number 4, regularly consuming excess sodium. Salt has a reputation problem, mostly because people associate it with the shaker on the table rather than where it actually comes from. The truth is, most excess sodium in a typical diet doesn't come from home cooking at all. It comes from processed and packaged foods, restaurant meals, canned soups, deli meats, and condiments, where sodium is used heavily as a preservative and flavor enhancer. Excess sodium has been associated with the body retaining more fluid, which increases the volume of blood the heart has to push through the vessels. Over time, this added pressure has been linked to hypertension, which remains one of the most significant risk factors for heart disease. What makes this habit particularly deceptive is portion size and frequency. A single indulgent meal isn't the issue. It's the pattern of daily exposure that adds up. Maria, a 49-year-old teacher, thought she ate fairly healthily. She rarely used table salt and prided herself on cooking most of her meals. What she hadn't accounted for was her habit of grabbing pre-packaged lunches during busy school weeks and her fondness for canned soup on cold evenings. When a routine physical revealed borderline high blood pressure, her doctor asked her to track her sodium intake for 2 weeks. Maria was stunned to discover she was consuming nearly double the recommended daily amount, almost entirely from sources she hadn't thought to question. This isn't about fear of salt itself, since sodium is an essential mineral the body genuinely needs. It's about awareness of where it's hiding and recognizing that reading a nutrition label occasionally may reveal more than expected. While we're on the subject of food, there's a related habit that tends to fly even further under the radar. Number 5, skipping meals and eating irregularly. In a culture that often praises busyness, skipping breakfast or pushing lunch back for hours can feel like a badge of discipline. But irregular eating patterns, particularly extended periods without food followed by large or rushed meals, have been associated with blood sugar spikes, increased inflammation, and unfavorable shifts in cholesterol over time. The mechanism here is fairly intuitive once it's explained. When the body goes too long without fuel and then receives a large meal, it can trigger a sharper insulin response than steady, regular eating would. Repeated over months and years, this pattern has been linked in research to increased cardiovascular risk, independent of overall calorie intake. Consider Frank, a 62-year-old retired postal worker who had fallen into a habit of skipping breakfast entirely. Telling himself intermittent fasting was simply the modern healthy thing to do. For some people, structured fasting approaches may indeed offer benefits, but Frank wasn't following any real structure. He was simply forgetting to eat until early afternoon, then eating a heavy dinner late at night, often within an hour of going to bed. His cardiologist noted that it wasn't necessarily the fasting itself causing concern, but the irregularity and the late, heavy meals close to sleep, which may interfere with the body's natural overnight rhythms. The takeaway here isn't that everyone needs to eat on a rigid schedule. It's that consistency, rather than any single perfect eating window, appears to matter more than most people assume. Number 6. Suppressing anger and difficult emotions. This one tends to catch viewers off guard. We don't usually think of emotional suppression as a physical health habit, but a growing body of research has drawn connections between chronically suppressed anger, frustration, or sadness and increased cardiovascular strain. The theory isn't that feeling angry occasionally is dangerous. It's that consistently pushing emotions down rather than processing them may keep the body's stress response activated in the background, similar to the effects of chronic stress we discussed earlier, but rooted specifically in unexpressed emotion. Some researchers describe this as an internal pressure that has nowhere to go. The heart rate may rise slightly during moments of suppressed frustration even when the face and voice remain calm, and repeated over years. This internal activation without release has been associated in some studies with elevated blood pressure and increased inflammatory markers. Patricia, a 67-year-old widow, offers a quiet but telling example. She described herself as someone who never made a scene, who kept things pleasant no matter what she was feeling inside. After her husband passed away, she continued this pattern, telling friends and family she was doing just fine, even as she privately struggled. Her cardiologist, during a follow-up appointment nearly a year later, gently asked whether she had support to process her grief, not because of any single test result, but because he had seen this pattern before in patients whose physical symptoms seemed to trace back to unprocessed emotional weight. This doesn't mean every emotional struggle translates directly into heart disease, but it does suggest that emotional health and cardiovascular health may be more intertwined than many people assume, and that having healthy outlets for difficult feelings isn't just good for the mind. It may be good for the heart as well. From something invisible on the inside, let's move to something people can literally see every time they smile. Number 7. Neglecting oral health. This is often the most surprising item on lists like this one, and it tends to be the sign we mentioned earlier that most people don't see coming. The connection between gum health and heart health has been studied extensively over the past 2 decades. Chronic gum inflammation, known as periodontal disease, has been associated with elevated markers of systemic inflammation throughout the body, and some researchers believe bacteria from infected gums may enter the bloodstream and contribute to inflammation within blood vessels themselves. To be clear, having an occasional cavity or missing a dental cleaning here, and there isn't going to meaningfully affect your heart. The concern is with long-term untreated gum disease, the kind that develops gradually and often painlessly. So many people don't realize anything is wrong until a dentist points it out. George, a 71-year-old man who hadn't seen a dentist in almost a decade, learned this the hard way. He'd avoided dental visits partly due to cost and partly due to simple procrastination. During a hospital stay following a cardiac event, one of his treating physicians noted signs of advanced gum disease and mentioned, almost in passing, that inflammation in the body doesn't stay neatly contained to one area. George later admitted he'd never once connected his oral health to his heart. Nobody had ever explained it to him that way before. Routine dental checkups, something many people deprioritize as they get older, may end up playing a quiet but meaningful role in long-term cardiovascular wellness. It's a reminder that heart health isn't only shaped by the habits we associate with it directly. Number 8. Drinking alcohol regularly, even in moderate amounts. For years, the conventional wisdom suggested that moderate alcohol consumption, particularly red wine, might actually offer some heart benefits. More recent research has complicated that picture considerably. Current evidence suggests that regular alcohol consumption, even at levels once considered moderate, may be associated with increased blood pressure, irregular heart rhythms, and over time, changes to the heart muscle itself. The habit that seems to carry particular risk isn't necessarily a single glass of wine at dinner. It's the daily, almost automatic pattern, the drink that's become part of a nightly wind-down routine without much thought given to frequency or amount. Because alcohol is legal, socially normalized, and often marketed as a way to relax, many people don't examine their consumption the way they might examine their diet or exercise habits. Susan, a 56-year-old nurse, is a case that many viewers may relate to. She wasn't someone who drank excessively by any conventional definition. Just one glass of wine most evenings, sometimes two on weekends. But when she developed episodes of an irregular heartbeat, her cardiologist asked detailed questions about her alcohol habits as part of the evaluation. It turned out that even her modest, consistent drinking pattern may have been a contributing factor, something Susan had never considered a risk given how controlled and moderate it felt to her. This isn't about vilifying alcohol or suggesting every drinker faces serious danger. It's about recognizing that moderate is a term that deserves a second look, and that a habit which feels harmless because it's small and routine may still be worth discussing with a healthcare provider, especially for those with existing risk factors. Some cardiologists now suggest thinking less about a fixed weekly limit and more about whether alcohol has become the automatic answer to stress or boredom, since that pattern, more than the substance itself, tends to be where risk quietly accumulates over the years. And now, the final habit, the one we hinted at earlier, and arguably the one people are least likely to recognize in their own lives. Number 9. Living with chronic loneliness or social isolation. This might be the most underappreciated risk factor on the entire list. Loneliness doesn't show up on a blood test. There's no scan that measures it. And yet, a substantial body of research has found associations between chronic loneliness or social isolation and increased cardiovascular risk, in some studies comparable in magnitude to more traditional risk factors like smoking or physical inactivity. The proposed explanation involves a combination of factors. Chronic loneliness has been linked to elevated stress hormones, poorer sleep quality, and reduced motivation to maintain healthy habits like cooking balanced meals or staying active. In a sense, loneliness may not just be an emotional experience. It may function almost like a slow-acting physiological stressor, quietly influencing many of the other habits we've already discussed. This brings us back to Diane, the grandmother from earlier in the video. After her sleep apnea diagnosis, doctors also discovered something else during her follow-up visits. Diane had become increasingly isolated in the 2 years since her husband's passing. Her children lived out of state, and most of her old friendships had quietly faded as people her age became less mobile. She hadn't thought of loneliness as a health issue. She thought of it as simply a part of getting older. Her doctor gently suggested that reconnecting socially, whether through a community group, a regular phone call schedule with family, or even a local senior center, wasn't just about improving her mood. It might genuinely support her physical health as well. What makes loneliness so easy to overlook is that it doesn't feel like a decision the way skipping a workout or eating fast food does. It creeps in gradually, often without anyone, including the person experiencing it, fully recognizing what's happening. And that may be exactly why it deserves more attention than it typically receives. So where does all of this leave us? 9 habits, some physical, some emotional, some social, all quietly connected to the same organ working every moment to keep us alive. What stands out when you look at this list as a whole is that heart health isn't only about diet and exercise, even though those remain genuinely important. It's shaped by sleep, by stress, by the emotions we carry silently, by the relationships we maintain, and even by how often we sit in a dentist's chair. If there's one figure worth remembering from everything we've covered, it's this. Research has repeatedly found that chronic low-grade stressors, whether from sitting too long, sleeping too little, or feeling isolated, appear to compound each other, meaning the real danger often isn't any single habit in isolation, but the way several of them tend to overlap in a person's daily life without anyone noticing the pattern. None of this is about fear, and it's certainly not about perfection. Nobody watching this needs to overhaul their entire life by tomorrow morning. And honestly, trying to fix all 9 habits at once tends to backfire, leaving people exhausted and discouraged within a couple of weeks. Small, consistent adjustments, standing up more often, protecting your sleep, reaching out to someone you've lost touch with, tend to matter more over time than any dramatic overhaul ever could. Pick one, just one. Give it a few weeks to become automatic before adding another. That's usually how lasting change actually happens, not through willpower alone, but through small, repeated choices that eventually stop feeling like choices at all. If something in this video reminded you of a habit in your own life or in the life of someone you care about, we'd genuinely like to hear about it in the comments. Which one of these 9 surprised you the most? Was it the connection between gum health and heart health? The idea that loneliness can function almost like a physical risk factor, or something else entirely? Sometimes just naming a habit out loud, or reading that someone else struggles with the exact same thing, is enough to make it feel more manageable. If you found this helpful, sharing it with someone who might need to hear it could genuinely make a difference, and subscribing helps us keep bringing you honest, well-researched health content like this. Thanks for watching, and take care of that heart. It's the only one you've got.